নমস্কার, আমার নাম ধনঞ্জয় রায়। আমার বাড়ি বড়বেলুন, বর্ধমান থানা, বর্ধমান ডিস্ট্রিক্ট, ভাতার থানা। আমি বহুদিন ধরে এই হার্টের প্রবলেম নিয়ে ভুগছিলাম। আমি ব্যাঙ্গালোর গিয়েছি, বর্ধমানে দেখিয়েছি, তাতেও আমার কিছু ভালো হয় নাই। আমাকে ললিত কাপুর ডাক্তারবাবু আমার আজ রোগ কালকে অপারেশন করে আমাকে সুস্থ করে আমাকে বাঁচালেন ভগবানের হাত থেকে। আমি একবারে পুরো সুস্থ। আমি এই দিন জীবনেও ভুলতে পারবো না, যতদিন বেঁচে থাকবো। RN Tagore নাম আমি সবাইকে করে যাব। আমি ভেবেছিলাম চাষবাস আর করতে পারবো না, আমি পেশায় চাষি। ডাক্তারবাবুর সঙ্গে কথা বললাম, ডাক্তারবাবু আমাকে বলল দিন 10-15 পর তুমি কুদাল নিয়ে মাঠে কাজ করতে পারবে। আমি সেই শুনে খুবই খুশি হলাম, আনন্দিত হলাম। আমি রোবোটিক সার্জারি হয়েছে, 2-3টে ফুটো করেছে, ডাক্তারবাবু কোনো কাটাকুটি করেন নাই। আমি খুবই উপকৃত হয়েছি। আমি নিজে স্বচক্ষে দেখলাম, 2-3টে মাত্র ফুটো করেছে, কোনো কাটাকুটি কিচ্ছু করেন নাই কো। এই নতুন প্রযুক্তির মাধ্যমে আমি খুবই উপকৃত হয়েছি।
Hello, I am Dr. Lalit Kapoor, a cardiac surgeon at RN Tagore International Institute of Cardiac Sciences. And it gives me great pleasure today to tell you about a first that I have recently done. Just yesterday, we did the first robotic-assisted bypass operation in this hospital. It took a lot of preparation, mental, physical, and organizational to get this concept on the ground. And we were able to successfully carry out this operation yesterday on a young man, just 60 years old, who had very tight disease in the coronaries. When we told him that we'll do a minimal operation on him through a small incision, he was quite happy because it meant that he wouldn't have any extra cuts on the body. And we of course convinced him that we will be doing a robotic on him, which is safe because we are already well established otherwise, and we have a backup plan. He willingly consented and we went ahead with the robotic-assisted CABG. In this, we were able to use a robot to harvest the internal mammary artery. And simultaneously, our anesthesia team gave us great support by using a special technique of endobronchial blockers to collapse one lung and the other lung, which enabled us to harvest the arteries. Plus, they gave anesthesia, the erector spinae block, which reduced the post-operative pain. The operation went off remarkably smoothly. Of course, the robot Da Vinci system is so well designed that it gives you great magnification and great endo-wrist manipulation, making the operation quite easy. Following the harvest of the mammary, we did the grafting of the arteries in the normal fashion that we do for minimally invasive surgery. And so that we are very confident of, which we have been doing for years. Patient's recovery was remarkably fast. He was ready for extubation, and in the morning when I came to see him, he was up having his breakfast. And in 3 hours' time, because there was hardly any drainage, the drains were out, he was sitting in the chair. And by 4 p.m., he was shifted back to his room. And in fact, when we asked him, he was asking to be discharged in the evening. He says, "I'm feeling good, why should I stay on?" It was his wife who says, "No, please keep him for a day or two more." And I was surprised by this recovery. I have never seen such a quick recovery from a patient. And maybe it was the good anesthesia, maybe it's a small scar, maybe it's just the euphoria of the patient. But whatever it is, I'm quite sure that this procedure is likely to make surgery a much better option than the classical bigger operation which sometimes frightens the patients. I hope to take this procedure forward by doing more patients in this technique, and hopefully the results will be better than even this one.